To do our little stretch break. She's with the YMCA South Coast, and she's going to lead us in a little bit because we have to nourish our own selves and our own. We've been sitting for a little bit too long today, so we'll do a little bit of stretching. She's a yoga instructor, and she also coordinates the Live Strong program for cancer survivors at the Y. So let's stand up. Stand up. You guys can go this way if you want. You're all going to look. This is all stuff you can do at your desk chair, from your kitchen chair, using your bathroom counter. Okay? We're going to just stand up. Just relax, you guys. Just relax. Okay? Just relax. All right, let's just take our arms up overhead. And just reach like you're hanging from the ceiling. Relax your neck. Reach up through the sides of the body. Feel your feet connecting down. Just stretch out. And then melt down. Melt. Just melt. There you go. And now soften your knees and just float your tailbone up into the sky and reach your heart center towards the ground. Any of you have ever taken a yoga class? This would be downward facing dog using a chair. Thinking about lengthening through the body. You can let your heels reach for the ground. Letting the heart center reach for the earth, tailbone is floating up, head and neck are nice and relaxed. Stretching out, relaxing. We're going to come forward now. Get a nice grip on that chair with those palms. Shift your body weight forward as we inhale, bringing your shoulders right over your wrists into plank pose. So we flatten out our back sides, right? But pull your belly button in. There we go. All right, one more, and then as we come up top, just imagine you're standing under such a refreshing waterfall. Sigh it out. Good. All right, take those arms overhead. Cooling down. Moonflower is more cooling. Sunflowers is a solar pose, energizing. So depending on what you need. Like if you've been at your desk, get up to sunflowers first, and then cool it down into moonflowers to return back to your desk. Good, all right. Come up top, nice waterfall. Relax. Anyone, yoga class? Tree? Right, tree pose? Nice, just don't rest on your knee joint. So we're above or below the knee. For tree pose. So you're working your hip, you're opening that hip, letting the fluids flow through the hip. Now spot. Okay, now potty break maybe? My first order of business is to confess that I was not involved actually in the writing of the regulations and the eligibility criteria, so I am presenting this information to you having only recently learned it myself, and based on the amount of excitement and enthusiasm in the room when Deborah presented this information, there may be some questions that I won't be able to answer, but I absolutely know the people who do have the answers, and I can circulate a sign-in sheet or something if you want me to contact you specifically after I continue your email. I also have some notes on the notes section in here that I forgot to print out, so if you can bear with me, I may have an answer right away. I just have to cheat a little bit. So the 5 things that I know we only have about 10 or 15 minutes each, so I just want to breeze through this. The 5 things that I wanted to talk about coming up from the state level, opportunities for employers in Massachusetts. Obviously the wellness tax credit is getting a lot of popularity right now. Involved with that also though is a model wellness guide, which is available now on the website and can be a great resource for you. Massachusetts is working on wellness program, which many of you participated in, is actually coming to an end as we look to do opportunities and new funding. But the toolkit is still going to be available, and it's a great resource. I'm going to touch briefly on the diabetes prevention program, and then a little bit of information about the Prevention and Wellness Trust Fund, which encompasses the wellness tax credit. I'm going to, if somebody can remind me again, I actually have a 6th announcement too. So the wellness tax credit came out of Chapter 224 Healthcare Cost Containment legislation back in August of 2012. And it stated in the legislature, actually, that the goal is really to provide opportunities for smaller businesses, undefined, to expand their opportunity for implementing wellness programs at the Worksite. And as Deborah helped us point out, it's a tax $10,000 tax credit, you would need to spend $40,000 on your wellness program, which might not be realistic for some of the smaller businesses. And there is a $15 million annual cap, but most of the discussion internally is that we're not anticipating that we would hit that in the first year. This is an annual cap, but we do have provisions for what would happen in that case. So some of the eligibility criteria include that you must have 200 or fewer employees. You must offer health benefits to the employees. Most of the employees in your business must work in Massachusetts, and you have to be compliant with basic OSHA laws. The application you have to apply annually, and what you do is through the online application on DPH's website, and I'll give you that website, you apply for a certificate, a seal of approval, as we're calling it, and submit documentation to DPH. You have until December 31st to do this, and then you'd file it the following tax year. You'd get a form that's jointly signed by DPH and the Department of Revenue that you would submit saying we are eligible for this tax credit. We are processing applications on a first-come, first-served basis, but the application is not available yet. We're optimistic for June 1st. You would either, after you apply, you would either get the certification, or if the cap has already been reached, you get a provisional certificate. If you were denied, you are entitled to request a briefing and have the opportunity to appeal it or understand what you would need to do in order to apply. Businesses are responsible for retaining records of the registration confirmation. So DPH's role was to establish eligibility criteria, which was a process that went through multiple iterations and public hearings. DPH is the one who issues the seal of approval in conjunction with the Division of Insurance, and then DPH is also responsible for that form that, along with the Department of Revenue, that actually we would submit when you're applying for when you are filing taxes. The business obviously needs to apply, so this is the website you're going to want to know. Mass.gov/wellness tax credit. It will redirect you to a much longer, much less friendly URL, but this is the one that we've sort of the front-facing URL that will help you get all of the information that you need. The tax application, the seal of approval application, will actually be available, like I said, we're hoping June 1st. But what's up there now are the full regulations and eligibility criteria written in legalese, as well as a guidance doc helping employers understand what they need to do to be eligible for the tax credit, and the Model Wellness Guide, which is written for consumers as well as employers and payers to help understand the value of investing in chronic disease prevention and management at the worksite level, and some kind of general how-tos for implementing worksite wellness, and then also some extensive resources which are going to be updated annually. What DPH is asking businesses who are applying for the tax credit to do is, there's a checkbox at the very end of the application that says, are you interested in participating with DPH in understanding how well this worked and rolling it out? And we would be very eager to have your participation in this. This is going to really help us revise things as we move forward and help make the process more streamlined, and help the business, help DPH understand what the business community needs. Something that, so the woman who was involved in the, in sort of spearheading this effort said to me, we want to find out from them. How can we help them? How can we be of service to you? In the ideal world, what do you need from the Mass State Department of Public Health to help you implement wellness? I mean, we obviously all have the same goals, so how can we best make this process work for you?
Can we ask for money for the collaborative?
The Model Wellness Guide, as I mentioned briefly, is written for multiple audiences, and it highlights the benefits as well as some how-tos and general resources, and this is available now online. I believe that the document that's uploaded still says draft. I was looking at it this week, but it's been finalized by the small team. Working on Wellness Toolkit, for those of you who didn't have a chance to go through the Working on Wellness initiative itself, really takes businesses through. It's written for businesses and wellness committees, really wellness champions. Walks you through a 7-step evidence-based process for building an infrastructure of wellness. And so this is, it's really helping you design a comprehensive wellness program. This is not just, who to call for lunch and learn, although those are probably part of it as well. But this process is, it's designed to be sort of slower than a lot of us might want it to be, but it's also designed to be sustainable. The website for this one, and we're revising the websites, we're hoping to kind of get this a little more accessible. The mass.gov website is notoriously not user-friendly. This one, what you'd have to do is mass.gov/massinmotion, which is our statewide obesity prevention initiative, so the working on wellness component lives under that umbrella. Then you click at work, and then you click for employers, because there's options for at home, at work, at school, and there's options for employers, for employees, so let's see if you find that. I did pass around slides, I just left them on the edges of the tables, so if you don't have these websites, they're in the slides, I can also email them to you. A little plug for the diabetes prevention program, which some of you who have been involved in the collaborative might have heard Dan Hafenrifer and Joan Hill come present on in February. This is an evidence-based 16-week curriculum designed to help people at risk for diabetes reduce their risk to either delay or prevent the onset of type 2 diabetes. So there are 16 sessions that focus on nutrition, physical activity, and a huge component actually on sustainability and supporting the environment around you to help you sustain this change. It's facilitated by a or two lifestyle coaches who kind of help the group really work on this together. And what DPH is doing is sponsoring trainings to be lifestyle coaches. So we did this last spring, and we trained about 20 coaches in the Commonwealth. We're hoping to train another 30 this June. So we're having, unfortunately, the Danvers session is full. But if anybody's willing to travel up to Northampton, just thought I'd throw it out there. Or if you know people out there who might be interested in doing chronic disease prevention, we do have slots open in the June 26th and 27th training in Northampton. It's 2 full-day training, but then you're provided with all the skills and materials necessary to actually go and deliver this curriculum. The Prevention and Wellness Trust Fund is another provision out of the Chapter 224. It provides for up to $15 million per year for 4 years for community-based prevention activities, and up to 10% of that is going to be invested in Worksite wellness. Funding is expected to go out summer or fall. We're still working on the RFR, the request for response, so when we're sending out, we're actually providing grants to communities. And we don't know the details yet of what this is going to look like. This is actually going to be a governor-appointed advisory board that really creates the criteria for who's going to get the funding. But what we do know is that we're expecting it to go to communities or groups of communities, and a stronger application is going to link the community with the healthcare setting, an ACO, and ensure local public health, businesses, schools, etc. We really want to see an entire community-based effort to prevent chronic disease and lower healthcare costs. So what can you be doing now as you're thinking about maybe would want to be applying this summer or fall, is to start getting engaged with the community partners. Come to the collaborative and understand what the other work sites in your area are doing. Connect with healthcare, connect with local public health to try to start thinking about what this funding might look like. My last announcement is that if anyone, it doesn't feel like driving to Northampton, but does want to drive to Boston every day for work, we have just posted a position for a full-time worksite health promotion coordinator. So this person will work in the Division of Prevention and Wellness, and we're looking for someone who has some experience already in worksite health promotion, as all of you do. So we're recruiting and casting a wide net. My contact information is here. I'll definitely take questions, I think, at the end of the panel, right? Which is people want to ask now, whatever.
Do you want to just hear the rest of it, and then we'll save questions for you? Is that okay?
Sure.
Thanks, Claire.
Can I put this on?
We have facilities in Fall River, New Bedford, Wareham, and also lots of outpatient sites. We have over 50 sites from Rhode Island all the way to Cape Cod, so we cover a fairly wide area. And what I want to talk about is some of the wellness resources that we have that local businesses could take advantage of. First of all, we have a very robust worksite wellness program ourselves. We have over 7,000 employees, and we kind of started with, the model of just offering lunch and learn type things, but now we've evolved into sort of a well-being program and have instituted all kinds of, policy changes that we're more than willing to share with people if you want to adopt some of them for your own workplace. So I think we can kind of be an example for that. Some of the things we've done is we've created an entirely smoke-free campus with lots of education and signage and...
I'm so sorry. I didn't know that was going to just start.
So we have policies procedures, examples of how we communicated this to our employees, and we're more than happy to share all of that with people. And we also do, it's a group smoking cessation class, but we're willing to offer that to the community. We do it at our hospital at a cost of just $25. It's 8 sessions. It includes a 2-hour quick session. And we're looking into perhaps offering it to off-site to businesses. Might be a slightly higher cost because we have to kind of bring things to the business, but we're looking at doing that. And we're also looking at doing some group sessions in public housing because we'd be reaching a lower income community there. Those would be free, but those are options. We're also the biggest referrer to QuitWorks in the whole state. So a number of our physicians, our emergency rooms, and off-site facilities, if you want to be linked with QuitWorks, it involves a referral process. We work with the Y to try to do that for some people who go to Y. So we're a resource for that. That involves, it's mainly a phone-based quitting system, but it's fairly successful. And then QuitWorks actually reports back to us on the people who have called the quit line, and they periodically check back with them. So it's a pretty good system, and we've had a lot of people in our region quit that way. We're also engaged in a number of policy changes for healthy eating. We've instituted a lot of healthy menu options in our cafeteria, and again, our food services staff is a resource for if you want to do this in your business. We certainly would be willing for free to give you our policies, give you examples of what we've done. One thing that we're engaged in right now is eliminating sugared beverages from all of our cafeterias and all of our vending machines. And this is kind of a process. We've actually gotten some pushback from employees. I think someone was talking about, sort of the notion of Big Brother telling you what to do. So our employees are pushing back that they want their soda, and we shouldn't be telling them that they can't drink soda. But the whole point of all of this is kind of people know what they should and shouldn't be doing, so you make the healthy choice the easier choice. And that's what we're trying to do with our cafeteria changes. We've also eliminated all fried foods, and frankly, people haven't even noticed. They haven't noticed that their French fries are now baked instead of fried. They don't know that the fry later is gone. So we're trying to sort of sneak the whole sugared beverage thing in that way by, just gradually instituting changes. But again, we're more than happy to share all that we're doing. Some of the programs, and these are all free, that we could bring to businesses we have out in the community. One is our cardiac prevention program. That's staffed by a nurse and a registered dietitian. And what they do is they go around they work quite a lot in schools, but also businesses out in the community, councils on aging. They provide biometric screening, so they do cholesterol, blood sugar, blood pressure. They have kind of an HRA that they do with everyone who they screen. And then they do a whole module of education on cardiac prevention. And then they go back. So it's not just a one-time thing. I think maybe it depends. Yeah, every 6 months they come back and revisit the site and see how people are doing. We've worked with Joseph Abood in New Bedford on this program for several years. And we've actually been able to document, people who have managed to lower their blood pressure, lower their cholesterol. So it's a great program, and you can take advantage of that. Because a registered dietitian is part of it, she can often do some cooking demonstrations. She has recipes to share, so she's a great resource as part of that team. We also have our South Coast Health Van. I'm sure you've seen it driving all over southeastern Massachusetts. We now have 2 vans. One, we just got a new screening van. That van is kind of targeted toward serving underserved residents, but we do go out to local businesses because Worksites are, often a site of reaching the people who we need to reach. And we also have our second van, in addition to doing screenings, also does blood donation. So what we do is we'll ask a business to kind of coordinate a blood drive at their business. There's no, it's not like you have to get 20 people to sign up to give blood. It doesn't matter how many sign up. It could be 1, it could be. And then we'll do the biometric screenings as part of that. And that helps us. I think a lot of people don't realize that we collect blood, and all of the blood that we collect is used for local patients. So we try to maintain a blood supply. So this sort of helps us, and also, helps Worksite. So that's a program, that we like to do. Another type of screening that we do that often people don't take advantage of is we do vascular screenings. So it's screening for a disease that's called peripheral artery disease, PAD. And so these are like really simple leg screenings. They take just about 5 minutes. We have a cardiac nurse who's devoted to doing these screenings out in the community. And the advantage of the screenings is that it's early detection for cardiovascular disease. So someone who may not have obvious symptoms of having a stroke or a heart attack, it's kind of an early warning system. And again, those are free, and a lot of times we'll do them on the van, so we'll bring the van to a business, to a council on aging. So we're always looking for sites to do our PAD screenings. We also have a cancer outreach program. We have a person who works in our cancer centers who's totally devoted to cancer outreach. So we do a number of screenings, again, often on the van. We've been doing a lot of work with fishermen in New Bedford because they're a very underserved at-risk group. So, for instance, we just did some head and neck screenings on a fishing pier in New Bedford. And that's what's great about the van is, we can go where we need to go. So we do ranging from skin cancer screenings to prostate screenings, head and neck screenings. So there's a number of screenings that we can do through our cancer outreach program. And our physicians are also more than happy to go out and speak at lunch and learn, kinds of events on cancer screenings. Or if you're having a health fair at your work site, we can certainly organize a number of our staff, in addition to the van and cardiac prevention, to come and either do screenings or provide education. We have a diabetes treatment group that will come out and do diabetes education. So a number of resources, and I think that kind of covers it. And I'll provide the information to Julie because there's lots of different people. You can either contact me or you could contact, depending on what you're interested in, all of the people who are out there doing the outreach.
Thank you, Carrie. I'm the Heart Walk Director at the American Heart Association, but I also work very closely with this program called My Heart, My Life, which I'm going to tell you a little bit about in the next few minutes. I don't have a problem projecting. I actually am also a singer. I didn't know that our yoga friend is also a singer, but I teach voice and piano lessons, so I'm sure they could hear me out there if I wanted them to. So, the Heart Association is really trying to lead a healthy movement in this country. And we really think that if we start with employers and we can implement a lot of these healthy lifestyle practices in the workplace, that you can bring them home to your families, we can influence your children, your families, your friends, and we can really bring that full circle. So we want to improve the cardiovascular health of all Americans by 20%, and we also want to reduce deaths from cardiovascular diseases by 20%. You all know that heart disease is the #1 killer. It's the #1 killer in Massachusetts as well. Stroke is the #3 killer, actually, but we have moved down nationally. It's now the #4 killer, so I guess we're doing something right. So when we look at this and we want to increase heart health, we're looking at how can we improve the number of people who understand that link between their overall health and their cardiovascular risk. So we've rolled out Life Simple 7 easy things that you can do to live better. Let's see if we can go through them. Let's have some guesses. What do you think the first one is? I'll give it to you. Cholesterol. The next one. Exercise. Next one. No smoking. Know your glucose, blood pressure, and weight. There you go. All right, so these are Life Simple 7. So we're establishing what is ideal cardiovascular health. We're looking at Life Simple 7, those 7 things. What's poor, what's intermediate, and what is ideal. I'm going to give away one of these kits right now, I want to ask you this question. Whoever gets closest. All right. What percentage of Americans said that they're at ideal cardiovascular health?
2%.
39%. All right. So can you guess how many were actually at ideal cardiovascular health?
2%.
1%. 1%. So 38% of the population thinks that they're at ideal and they're not. So how are we going to get them to change if they're not? They don't even know that they're not. Okay? So we rolled out this My Life Check health assessment. Big Five has done this actually, an example here. They asked their employees to fill this out. You get your cardiovascular score based on Live Life Civil 7 out of 10. So maybe your score is a 9.2. You're doing well, but you're not a 10. And these are the things that you can do to get to 10. So this is a free resource you can take advantage of. If you're interested in providing reports and seeing who at your company is doing it, have them use your company email, and I can pull a report for you. All right, I'm going to go right into health and families. You know, as we know, our supersized kids in this country is a major, major problem. And if we can influence people at work, we can get them to do it at home. All right, so I'm going to show you guys this video real quick.
As long as the parents. That's why the American Heart Association created this new comprehensive health, wellness, and fitness movement, My Heart, My Life, to empower Americans to get healthier. As part of this movement, the American Heart Association is launching innovative programs in communities across the country focused on eating and cooking healthier meals, getting daily exercise, and learning how to grow nutritious foods. We bring communities together with the common goal of improving health through fun and engaging activities like community kitchens,
My heart, my life, my community.
teaching gardens,
My heart, my life, my garden.
walking paths, and family fitness activities.
My heart, my life, my path.
With over 99% of Americans needing to improve their heart health, we want to encourage all children, adults, and families to get active together.
My heart, my life, my family.
Join the movement, myheartmylife.org.
So those are some of the things we're doing in the community. The Heart Association is doing all these initiatives nationally. You may see some of these playgrounds pop up, some walking paths pop up, some teaching gardens. These are things we can do to educate the community so we create this whole culture of health. This is just a slide talking about that less than 1% is an ideal in all categories. Children, not even 1% is ideal. That's a huge, huge thing there. Anyone who has children, I mean, the biggest thing you want to do is in the future have your children have a better life than you have. And they're saying our children are going to have shorter lifespans than we are. We can't let that happen. So this is really what we want to do, and how it ties into is it really starts at work. We want to go from that to this. All right, it's not magical. So we can but it really starts at work. So it starts with My Heart, My Life. So you know, we all know why it's important at work. The statistic that we use is for every $1 invested in Worksite wellness, companies can see a return of $3. I guess 3 when she was doing that survey, but 5 is even better. So we have a walking program. That is what this kit over here is about. This Worksite Wellness Walking Program kit that you can use at your company. There you go. We have an activity tracker on our website, also free. And if you go into it, you can track your daily physical activity, your daily diet intake, set up a walking plan. You can track walking paths in the community and save them so that you can walk that same path every day and you know how many miles it is, how many steps. This is kind of what it looks like. It's a great resource. It's based on research developed by the American Council on Exercise in collaboration with AHA. We have this wonderful website. We also have walking clubs and a walking path app. So if you have a smartphone or an iPhone, please, Android or Apple, it works. It also works on tablets. So that's another resource. You can start a walking club at your company. All your employees can get together and they can walk together. We also have a couple of icon days throughout the year that your company can put on your wellness calendar and celebrate each year. We provide a turnkey toolkit that goes with each of these icon days. National Walking Day is, we just celebrated actually a couple weeks ago. The first Wednesday in April is always National Walking Day. The recommendation is to get your employees together for a 30-minute walk at lunch or after or before their shift, whatever you choose, and get them out there. Teach them healthy and safe walking places around your business. And you can even use that lovely kit again to mark that path, indoor or outdoor. National Eating Healthy Day is the other icon day that we focus on. This is in November. It is the first Wednesday in November, and it's all around eating healthy. And guess what? It's right in the holiday season, which I joke is the season of gravy, okay? So we got to get everybody to think, what healthy things can I do around the holidays to limit that weight gain, that poor nutrition, and the inactivity that tends to happen in that high-stress holiday season. With National Eating Healthy Day, there is also a turnkey toolkit that you can get from the American Heart Association for free. And you can take advantage of our Holiday Healthy Eating Guide that is part of that, with healthy recipes and advice on how to change the recipes you're already making to make them a little bit healthier. So we celebrate that in November. This year it was November 7th. And then this is something that we talked about when she was introducing me earlier, fit-friendly work sites. There are a lot of work sites, especially here, and you're all doing a lot of the great things that are going to make your employees healthier. And the Heart Association would like to celebrate that because you're really, the movers and shakers, and you're making a difference here. So this national award is 2 levels. We have some folks here that got the gold level. We have Joseph Abood, we have Bank 5, and we have Bay Coast Bank and South Coast Hospital here that are here today. So congratulations to you all at the gold level. If your company would like to apply for this, the next deadline is November 1st, okay? It looks at physical activity in the workplace, nutrition, and overall culture. If you're interested in looking at that application, seeing all the things that go into it, our website is there, ffc.heart.org, and it's also in that little packet that I was sending around. These are the companies, again, that have been recognized. We're actually going to be presenting these awards at the Heart Walk next Saturday, May 18th. So we're looking forward to celebrating those folks. I also would recommend checking out our website. We've got a nutrition center with great materials. We've got resources for quitting smoking, getting healthy. One of the things we get as feedback from a lot of people are eating healthy costs more, right? They're worried about the cost of produce. They're worried about the cost of healthy food. And on here we have some advice for families. How can we have healthy foods under $1? And how can we get our kids to be eating those healthy things on a regular basis? So please do check that out if you're interested. We also, what makes all of this possible is really the fundraising that we do to support research and education in these programs. Our Heart Walk is our biggest fundraiser that we do to support these initiatives. May 18th is our next date. I know it's a little close for you to, add it to your schedule, but if you want to come down and celebrate with us, next Saturday it's at Colt State Park. We're going to have about 3,000 people there, and we're hoping to raise $450,000 for cardiovascular research. We're lucky in this part of the country that we are funding about $37 million in Massachusetts in research. A lot of that is happening in Boston. And also in Rhode Island, we have about $1.3 million that we're funding in research as well. So if you want to help us fund that research, please do come down next weekend. And in closing, I wanted to review this Worksite Wellness Kit that I'm offering to you today. If you would like to sign up, just fill out your contact information. What we do is I come down, I bring it to you, I hear about what you're doing at your company, and I would help you decide which pieces of this wellness program are the best and the easiest to implicate into what you're already doing at your company. It includes a coordinator's guide, a CD, which has electronic copies of posters, flyers, communications, one-page overviews of National Walking Day, Eating Healthy Day, Fit Friendly, Heart Walk, and AHA-approved healthy recipes. And it also includes walking path icons, window decals, participation cards, walking distance stickers, motivational flyers, promotional posters, and group goal posters. So if you're interested, please do let me know. And thank you so much for helping to make your worksite healthier.
I am. For those that don't, I'm Angela Brass, and I do Worksite Wellness for Partners for a Healthier Community, which is a very small 501c3. I service Fall River, Somerset, Swansea, and Westport, but I do reach out to New Bedford and above. But my goal is really just, I'm your broker for wellness at no cost, which is always good. I connect you to Michelle and Kerry and Claire for questions and whatnot. What I follow and get a lot of my resources through is the Working on Wellness Toolkit through DPH. So I'm happy to come to any of your work sites and talk about how to do an HRA. I also have surveys available, or we can tweak it to your site. We can also do data analysis, and I partner through UMass Dartmouth to do that. And then after we get the data, we go through it and talk about recommendations for your site. And I recently got certified to be a tobacco treatment specialist through UMass Lowell. And what that means is that I can come to your site and do one-on-one smoking cessation to help your employees quit smoking. We can do an 8-week program or a 12-week program, and I modify it to your site. Because as most of you know, every work site is different, and it's not all one cookie cutter lesson. So we talk about what your needs are and how long the program needs to be. And like I said, I can do a group session and one-on-one as well if they're interested in that. A lot of it is around addressing the ambivalence that the smoker is going through, and then it has the context of motivational interviewing, which is really important. And a lot of what Francesca was talking about. I have cards, business cards, if you'd like to reach me, so I can leave those on the back table. If you're interested in taking one, that's fine. Or you can reach me directly at worksitewellnessma@gmail.com, or my cell is 774-400-4466. And I think that's about it.
Thank you, Andy. Claire, on the DPH's grant, if you're an employer with 200, you're definitely out, correct?
So the tax credit?
Yes.
It's is it 200 and fewer?
No,
It's
under
200 or fewer is what I had. It's 200 or fewer.
You're definitely
So
out if you're
over 200, you're out. So you can have exactly 200 and still
Okay.
apply, yeah.
So my next question for those who are able to apply for this is, how does the employer figure out what they've spent to get that? Like how many years back can they go? Or is this just in the past year?
It's an annual,
Oh,
it's how much you spend annually. But you
Okay.
can use, so it is a little flexible though in how you can estimate the cost that you've spent. In-kind staff time, that kind of stuff will all count. But the guidance document will have more specific information, and I can certainly look up some more specific information.
I was just curious for the others, because I didn't know how they would determine that it was a 2-year period, a 3-year
Like if you
period.
did, if you built a gym on site 3 years ago, I don't think that counts.
Another question, Claire, with regards to, is there any, it's only for businesses, what about not-for-profits? Because we don't pay taxes, so it's tax credit, so there's nothing for incentives for not-for-profits.
Yeah, I did the webinar and they said no for non-for-profits, and municipalities are even being questioned at this point.
Oh, municipal.
What did you hear? Is that what you heard? I think it's just through the tax. Yeah. So if you don't pay taxes,
Credit.
I'm gonna go with that. That's
Yeah, I
my-
guess so.
Yeah.
Okay, thanks.
When is the National Eating Healthy Day this year?
It will be, it's always the first Wednesday of November. So, it will be November 6th. Yep.
I think that maybe this year we'll try and have our October meeting, which is always the second Thursday of the month, that we'll use either the September or the October meeting to talk about like planning maybe around, you know, like some activities for the worksite to do that. Because I think last year it happened and it happens like before we were able to really put it into our schedules to plan ahead. Also, the American Heart Association has their wear your sneakers to work day. I don't know what it's called, National Walking Day, which is in April, which is another thing that I think that the collaborative can sort of use to, you know, put that on the radar screen a little bit earlier so that you can plan it into your wellness calendar at your work site, and it doesn't take a lot, you know. And that's just something, again, if you have senior management that says, yes, we support it, then, you know, let everyone wear their sneakers to work, or give them an extra 15 minutes for lunch, you know, so that they can, you know, get out and walk at lunchtime or something like that is really, it does so much to make people feel good about where they work, in addition to the health benefits of it, that it's a, you know, real strong motivator, I think. Anything else? Hey, before you leave,